effect of plasma protein binding. So what are the effect of plasma protein binding? You can remember plasma protein binding, the effects you can remember from 4Ds. 4Ds. The first D is distribution. We just discussed what will happen to distribution if plasma protein binding is high. So distribution we already discussed. If more binding means less distribution. Okay. Second D is duration of action. Remember, if a drug has high plasma protein binding, the enzymes cannot break that because the drug is binding to protein, so it is protected. So it will act as a storage and slowly it will keep on releasing and keep on working. So duration of action usually increases. More plasma protein binding, usually duration of action is high. Third is displacement. Displacement simply means if two drugs have high plasma protein binding and both are binding to same protein, so then there will be a competition between the two. दोनों में competition होगा, and whichever drug is displaced, only one can bind, both cannot bind. So whichever do not bind, that will become free and that can become toxic. So in displacement simply means there will be drug interactions. So if a drug has high plasma protein binding, it is more prone to drug interactions. Okay. And lastly, the fourth one is a dialysis. D for dialysis. Someone was asking about dialysis. Remember, we do not filter proteins in dialysis. So if a drug has high plasma protein binding, we cannot do dialysis, not dialyzable. Okay. So dialysis will not be effective in drugs whose plasma protein binding is very high. Okay. So 4 Ds in plasma protein binding. And the fifth we will come later on when we will excretion. If a drug has high plasma protein binding, its glomerular filtration will be lesser. Glomerular filtration cannot occur because proteins are not filtered by glomerulus. So these are the 5 importance of plasma protein binding on which question is asked.